Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. We're going to be speaking with Dr. Sammy Elmariah. He's joining us here from Massachusetts General to talk about his recent research that was presented at the 2021 American College of Cardiology's annual scientific meeting. Welcome to Health Professional Radio, Dr. Sammy Elmariah, and thank you so much for taking the time this evening.
Great. Thank you very much. It's great to be here.
Well, give our listeners a bit of your professional background for those of us who are listening who may not be familiar with you, and talk briefly about your role there at Mass General.
No, of course. So I am an interventional cardiologist, and my career, both clinical and research, focuses on treating valvular heart disease. And so much of what I do is within the transcatheter valve replacement and repair space. I also serve as the Associate Director of Research here, of Interventional Cardiology Research here as well, and so have a fairly involved degree of participation in many ongoing clinical trials.
Are you dealing mostly with people in older years, or does it run the gamut of age and male and female as well?
I would say, thankfully, we have a fairly good balance of male and female, but the huge majority of patients that I treat are in advanced years, so I would say probably around 70 to 80 years old on average.
Transfemoral tricuspid valve replacement in patients with tricuspid regurgitation, 30-day results of the Triscend study. Why is the data that was presented at the 2021 scientific meeting so important?
Well, so that's a fantastic question. I mean, I do think this is an area that's going to completely change the way in which we think about this disease process, specifically tricuspid regurgitation. So to give you a little bit of a background, so TR, or tricuspid regurgitation, is exceedingly common. It's estimated that about 1.6 million people in the U.S. have significant tricuspid regurgitation. And despite that, a very small number are ever treated surgically with valve replacement or repair. Somewhere on the order of less than 8,000 cases annually get some sort of treatment beyond simply diuretics. And historically, what we have been taught is that the tricuspid valve doesn't matter, and that you can simply treat the symptoms, treat the swelling, and these patients will do fine. And so a lot of times people refer to this as the forgotten valve because it really has this surrounding stigma that it is not clinically meaningful. But as we're starting to learn, that seems to be inaccurate, and we do know that this problem does have a tremendous impact on people's day-to-day lives. That it's associated with an increased risk of dying, that it's associated with increased risk of liver dysfunction, kidney dysfunction, and so it really is an important problem that I think warrants greater degree of attention by the healthcare community. And so the study you're alluding to, the Triscend early feasibility study, is a single-arm study. It's essentially the first step in evaluating this novel approach for treating tricuspid regurgitation using a transcatheter procedure. And specifically, this is a transfemoral device that comes up through the femoral vein and implants a brand new valve. And so this study is sought to evaluate the safety and performance of this new procedure.
Prior to your study, was there some groundbreaking information that was gathered to give this valve much more consideration than previously had been given to it?
Yeah, I mean, that's a great question. You know, over the last 15 years or so, we've been working on developing transcatheter therapies for valvular heart disease. And of course, I'm sure you're familiar with transcatheter aortic valve replacement, or TAVR, or TAVI as we now refer to it, transcatheter aortic valve implantation, and also transcatheter mitral valve repair. And so there's been increasing interest and very rapid evolution and expansion of the transcatheter valve therapies that are available. And what I believe really led our focus or brought our attention to tricuspid regurgitation is that in extreme cases, a few of us interventional cardiologists around the world essentially used off-label devices or used devices in an off-label fashion to treat tricuspid regurgitation patients. And we started realizing that this was resulting in a fairly dramatic degree of clinical improvement in these patients. And so as a consequence of that, I think it started to increase attention to the tricuspid valve and increase the development of devices such as the one studied in the Triscend study that could actually treat this valve pathology.
So what were the major takeaways from this Triscend study?
Well, so the major takeaways is that, again, with a very early experience, this device proved to be quite successful and efficacious in treating tricuspid regurgitation. The major findings were that there's nearly 98% device success, that the huge majority of patients, 98%, actually had a reduction in their tricuspid regurgitation to mild or trace in severity, which is truly quite remarkable. There were significant improvements in patients' functional capacity, their quality of life, how far they could walk. And this is despite the fact that the study was a mere 50 patients or so. So it really did have a tremendous impact despite the small numbers in regards to the again, patients' clinical outcomes. The other very important piece, of course, is the safety. And the huge majority of patients did not have any degree of major adverse event. Mortality rate was low, stroke rate was 0, myocardial infarction rate was 0. The mortality rate, as I mentioned, was actually around 2%. So it clearly does, I think, lay a foundation for further work in this field and really demonstrates that we can effectively reduce tricuspid regurgitation without putting patients at an increased risk of an adverse outcome.
Is another study in the works as we speak?
Yes, absolutely. So this, as I mentioned, was an early feasibility study. This was the Triscend 1 study. Currently, we are enrolling in the Triscend 2 trial, which is the pivotal randomized clinical trial evaluating this same technology, which is the Edwards Lifesciences Evoque valve. The current trial is randomizing patients in a 2-to-1 fashion against optimal medical therapy.
Well, give our listeners a website where we can learn more about this study and more about Mass General.
Well, so certainly one can navigate to the Mass General Heart Center website, and we, of course, have an Interventional Cardiology Research page that outlines this very important trial, as well as many of the other transcatheter valve trials that we're currently conducting.
And I do believe that a web address would be www.massgeneral.org. Is that one a resource as well?
Yes, correct. That's the general broad website, yes.
Well, Dr. Elmariah, I appreciate you joining us here and giving us a bit of your time this evening. Thank you so much.
Oh, it's my pleasure. It's been great speaking with you.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Sammy Elmariah, Director, Interventional Cardiology Research at Massachusetts General Hospital. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.